Congresswoman, thank you so much for being here with me. I know that hours before we spoke, you were out there with the people of Georgia, speaking to folks who are really impacted by this government shutdown. What were you hearing this morning?
Well, thank you so much, Faith. And of course, the people of Georgia are rightfully so very anxious and very worried and very concerned. But this morning, I was really pleased to take part in a press conference with Keep Americans Covered to talk about the expiring enhanced tax credits for the marketplace healthcare plans, which many of the people across Georgia have. That's how they get their health care. Then after that, I met with board members and employees at the Atlanta Community Food Bank to discuss the rising demand for food and any implications that the shutdown might have in terms of assisting the metropolitan Atlanta area. And then from there, I actually met with members of AFGE representing the TSA employees at Hartsfield-Jackson International Airport. And that's just one group out of so many federal employees that are working without pay right now during this shutdown. And, I love being in my district, and it's important for me to be here, but I should be back in Washington right now in D.C. with my colleagues. We need to be voting on a deal to make sure that the American people actually have the health care that they deserve and they need. Speaker Johnson has basically canceled all votes. It looks like we're going into another week without voting, and Republicans have just kind of let our government shut down with just weeks before the healthcare crisis is about to ensue. So I'm in the district trying to make sure that I am listening to our constituents and stakeholders and trying to give them as much information as I possibly can to ensure them that I am doing everything, and my Democratic colleagues are doing everything that we can to bring our Republican colleagues in this White House back to the table to create a bipartisan funding package to protect American citizens.
Thank you. And I do want to hit on that. I know that you joined your Democratic colleagues in Congress with a letter to Speaker Johnson asking for him to call the House back in session to try to work out some type of deal to open the government back up. He has said that he doesn't see any room for negotiating. What's the plan here? If he does call you all back to come work, what is the plan to try to find that silver lining to open the government back up?
Well, of course, my Democratic colleagues and I, they're in Washington. My colleagues and I are moving in and out of Washington, standing at the ready anytime that the Republican Party has determined that they're, tired of being on vacation and really willing to negotiate. And historically, we have always worked together in a bipartisan manner to find bipartisan funding, keep the government open. We've always done that. So this is unprecedented at this point. We have never had a situation like this where the Republican Party, under the leadership of this president, has said, we are not willing to negotiate. We're not willing to come to the table, and that this is take it or leave it, even though they know that millions of Americans, people that they actually represent, are going to be drastically hurt by the loss of their health care. But they really don't seem to care. But what we know that we must do is continue to stand firm. My Democratic colleagues and I continue to stand firm, stand at the ready to negotiate, calling them out to come back to Washington and do what's right for the American people. And we will continue to do that. We'll continue to give information to our constituents. We'll continue to dispel the false narratives that are also being circulated about the Democrats calling for this government shutdown. Look, let's be real. The Republicans have the White House, they have the House, and they have the Senate. They are in charge of this government, but they are not governing right now, and the American people deserve so much better. And my colleagues and I will continue to make sure that we stand in the gap to protect our constituents and the American people's ability to have access to the health care that they deserve.
And I do want to touch on healthcare as we know, I mean, healthcare does not see red or blue. It just sees humans that need healthcare. Republican Marjorie Taylor Greene, one of your colleagues, making headlines for some of her thoughts, almost kind of distancing herself from her other Republican colleagues, saying that she also sees that her constituents are going to they will not benefit if the ACA expiration happens. She did say, she doesn't agree on everything, but at least that is something different than we're hearing. What is your response to her thoughts? And do you believe that more Republicans like her need to come out publicly and speak against this for some movement to happen?
Absolutely. I may not agree with my Republican colleague on everything that she says or does, but in this instance, I absolutely concur with her. She's right. As you said, healthcare doesn't see red or blue. When these tax credits expire, every single member of Congress has individual constituents that we represent that are on this ACA healthcare marketplace. And they're going to see by November 1, when they go into the marketplace to register for their healthcare choices, even before then, they're going to see a drastic increase in their healthcare premiums. So she's absolutely right in that regard, that we're all affected by this. And yes, I do hope that her colleagues are paying attention. I do hope that her colleagues are not standing behind closed doors and agreeing with her, but will be willing to stand up front, do what's right for the people that elected them to serve and to keep them healthy and safe. Right now, the American people are far less healthy and safe under these circumstances.
What's your response to Republicans who say, let's just open up the government now and talk about this health policy down the road?
It has been my Democratic colleagues. We have always been the ones that have tried to negotiate and come to the table and find bipartisanship with each and every impending government shutdown. It has always been the Democrats that have understood the implications and how devastating it is to hardworking families in this country if there is a government shutdown. I would really hope and pray that if the Republicans, and if this is what they're espousing, then actually come back to Washington, Speaker Johnson, call us back to have votes. Don't speak and then do nothing. You have to follow up with actions that truly represent, what you really intend to do. We have done this before. We've been around this mountain before. And the Democratic Party, my colleagues we're just standing in defense of the ability for the American people to not be hoodwinked. And so if it is your intention, Speaker Johnson and the Republican Party, to negotiate, then call us back so that we can come to the table, find a bipartisan agreement, and make sure that this government shutdown is over and that the American people have the health care that they deserve. We're standing in the wings. We're waiting. We've been asking them to come to the table, but they are following President Trump. And if he says don't negotiate, then Speaker Johnson is doing exactly what he's asking them to do.
Congresswoman, what is your message to President Trump in this moment right now?
My message to President Trump in this moment is, you made promises to the American people when you came into the presidency in January. You promised to lower the cost of their groceries and their goods and services. That has not been accomplished yet. You said that you would make sure that you were abolishing waste and fraud, but that has not been the truth, because in doing so, what you're doing is you are taking away the lifeline and lifeblood of the American families that need health care, need to be able to keep food on their tables, need to make sure that their children are educated, need to make sure that they have access to affordable and quality health care, and you're doing none of that. So you've sold the American people a damaged bill of goods. They deserve better than that. Come to the table with my Democratic colleagues. Let's work on bipartisanship, which is what we have always done in the past. Come in good faith and make sure that we're protecting and serving the American people in the way that they deserve.
Congresswoman, is there anything that I did not ask that you would like to put out there to your constituents or to your other colleagues in Congress?
What I do want my constituents to know in particular is that under this government shutdown, please still continue to call on us. I know that there are some government agencies that are not answering, but I do know that we are a conduit to federal government agencies to help make sure that you are receiving the benefits and the help that you deserve. Continue to reach out to us. We are trying our best to follow the agency's guidance for constituent services. And so we'll do everything that we can to make sure that we're helping our federal workers. But I want to say that the Democrats are doubling down, and we're going to make sure that we do everything that we can to protect American families, hardworking families. And that is something that I believe is the essence of what this fight is really about.
Congresswoman Lucy McBath, thank you so much for taking the time to speak with us. We truly appreciate it. Thank you.
Thank you, Faith. Thank you so much.